nation, under God, indivisible, with liberty and justice for all.
Commissioner Zell, would you lead us in a word of prayer?
Yes, Mr. Chairman, this is the prayer that my wife will be offering to, no probably right now, is offering to the House of Representatives in Santa Fe. Dear Lord, our God Almighty, you have traveled down the road with me since my conception. You gave me loving parents who instilled in all of their children what your role is in our lives. God, you looked down on the earth that you created and you said, I need a caretaker for this world that I have made. And so you made farmers and ranchers. While my parents taught us all about life, the farm taught us what life is all about. Dear God, I have been defeated, but not conquered. I have been disappointed, but not discouraged. And I have learned to be more enduring and conscientious in the roles to which my life is dedicated. I am ever the optimist, or I wouldn't still be a farmer and rancher. Just remember, Lord, some of the best cowboys are girls, and lots of farmers are farmers. God, you have given us life. You have blessed us, laughed at us, cried with us, and brought us untold joy. I am asking that you give all the members of this body the wisdom, courage, patience, and tolerance needed to make decisions that benefit all the people of our great state. One more thing, God, when you see fit, please send some much needed rain. Amen.
Amen. Thank you, Commissioner. All right, Ms. City Fuller.
Mr. Chairman, you have a quorum.
All right, so we've got a lot of elected officials that I know that are watching this from different parts of southeast Mexico, and we have some elected officials in the audience. So one of the things that I would like to do today with our presentation from Dr. And I hope I'm not butchering your name, Dr. Sosa, but that's going to be
Good.
okay. So anyway, we're gonna run this special meeting where if we have any elected officials that want to ask any questions, please, if you're out there virtually, raise your hand or at least can see it. We'll get you to where we're gonna do questions from our elected officials. If the elected officials that are here in the room have questions that they want to ask, please don't hesitate to get our attention, and we'll bring you up to the microphone so that you can ask Dr. Sosa those important questions. One of the things that we would like to make sure is that if a question's been asked, let's not be redundant and asking the same question over or something that's going to be similar to that. For those others out there, yes, Dr. Sosa trying to catch all the conversation, so it's just me talking right now, Dr. Sosa. I don't know if you could hear that, but if there's anybody out in the audience who's not an elected official, please send a message to through Facebook to Elise, and we'll see if we can get those questions answered. So, with that being said, Dr. Sosa, thank you so much for being here today.
That's the second set of numbers you gave me.
We're ready for you to give us a great presentation.
You may have to repeat yourself. He just sent a message that he's not hearing you, so we're experiencing a bit of technical difficulties.
Let me see if that helps at all.
He could unmute himself.
There's no opening. I don't see Kevin.
Yeah, where's Kevin?
Let me see if this helps at all by connecting my.
There he is right here. He
My-
shows
Oh,
muted.
yeah, he says he's unmuted.
Dr. Sosa, is that any better? Turn it back on, let's see.
I don't know. But getting a loop when he talks through that back to the microphone.
It's because he's on mute.
Well,
When he's
trying to get to where I'm at, my
earphones
earphones
to the microphone to talk.
We can do that.
But it have to come from the Facebook page because I think that's what
Now, there we go.
Okay.
Face.
Hmm. Okay.
So, Dr. Sosa, can you hear me now?
It's his microphone. Mute your microphone.
On your lap.
No, I think you're fine. We have all our audio here.
Huh?
Can you still hear me, Dr. Sosa?
It's because he's the presenter. Okay.
What if everybody else mutes? I mean, can you hear me now?
Can you hear me now, Dr.
You can.
Okay.
Yeah, we're
Okay, we're gonna get started. Let you go ahead and start doing your presentation while we figure out our audio. Okay, thank you all so much, for inviting me. I'm happy to do my best to answer your questions. I was informed that you had initially some questions about the red to green framework and how those, testing metrics, get calculated. And I wanted to start there just to talk a little bit about that process. And then answer questions on this topic or any additional topics that would be, help us. On the first,
No, they should be able to hear.
topic of the cognitive test. There's a question about how do we know that we're getting all the tests, and that the test results are accurate. The New Mexico Administrative Code requires all laboratories and all healthcare providers to report notifiable conditions of COVID-19 or infection with the SARS-CoV-2 virus is a notified condition. And we require all laboratories, all testing facilities, and providers to report both positive and negative results. This is easiest when done through one of the large laboratories like Tricor or Quest or LabCorp, because we can arrange with them to transmit all the results associated with tests for SARS-CoV-2 electronically. And that way we have timely, accurate.
This is the meeting ID.
Directly from the lab. Many new facilities have been testing for SARS-CoV-2, the virus that causes COVID-19, over the course of the pandemic, and we work with them to ideally onboard them for electronic submission, or other ways that they can send their laboratory results, both positive and negative laboratory results. We do know that we're getting highly complete reporting on the test for this virus up until the point where we start having a lot of testing being performed at home tests, point of care tests that those people may not know that we are required for reporting, not familiar, certain people comes to anticipate that kind of report. But the testing right now is happening largely through laboratories, almost exclusively through laboratories, and we work with those laboratories to make sure that they know how to transmit to us and then getting regular transmission. The next question thresholds, how case rate and percent positivity inform our understanding of spread of the virus in the community, and how they're used in this race to breed framework that will be included policy. Really what we're trying to understand through the recipe metric is the amount of virus in the community. The more virus you have, the more risk of spread there is. The more virus is in the community, the higher the chances that one person in a household, or one person in an office building, or one person in a shopping center, if you interact with them, might have the virus. So the thresholds are really designed to identify the levels at which we believe the healthcare system won't be overrun by out of control threats, and that we can minimize spread while continuing to have the required data actions that we need to have.
We're using Zoom.
So the governor has set threshold for both the rate of disease, that's the number of infections, in this context, the number of infections, a 2-week period of time divided by the population, so that would be the rate of infection in the community. The percent test positivity is something that has been used in many places across the country as an indicator of whether we're identifying too much infection that is really occurring. It's not as direct a marker of community
Well, I know the
spread
best bit is right.
as a rate is. But what it does is when it gets elevated, it tells us a higher percentage of people who get testing positive. It tells us that we may be missing infections that are occurring in the community. So it tells us we need to increase testing to be sure that we're finding the people who are infected so that they can isolate and have their contacts in quarantine and reduce the spread. And so it has often been used as a single measure. When the community does not have the ability to calculate rates. But together with the rate, it helps us understand in the presence of adequate testing, we see a low rate of disease, we have confidence that there is less community spread, and we can think about activities that have a higher rate of transmission. Couple of the questions I've been anticipating. How does increasing testing capacity improve how does increasing the testing capacity affect percent positivity? So I know Dr. Straight and others have spoken of this being one of the two metrics that you can more readily control if you get your testing rate higher. The likelihood is that you're going to be testing more people who are not infected. And so that the overall percentage of positive results will go down. That's because testing prioritizes people who have symptoms, so they're most likely to be infected. And then persons who are contact known cases of COVID-19 who are at an increased risk also given their exposure to becoming positive. So if we continue to expand testing beyond that, such as what's called surveillance testing or screening testing that might happen in schools and businesses, you're more likely to pick up a greater proportion of people who are not infected, and that brings your baseline. Now, that's a kind of a way to work around the percent positivity metric, but the good part of it is that we have confidence by increasing testing capacity that what we're measuring in the community is an accurate reflection. There was a point in time when the percent positivity was upwards of 20%, 1 in 5 people tested. And we know that when it gets that high, that we're missing large numbers of people in the community who are infected, and there's a lot more transmission. So that's the way that metric works and how it can be affected by the amount of testing that you do. Let me stop there and see if there are questions about this particular topic, testing, or anything else I can do that to respond.
Commissioners, any questions to this one? Anybody in the audience, elected officials that have any questions? Dr. Zolson, I don't see any other questions, but as of right now, so if you'll go ahead and proceed.
Not hearing you particularly well, but if you're asking me to stay on, I'm happy to stay on until there are questions.
No, go ahead and proceed if you can. Did you hear that? Okay.
Okay, so let's go ahead and proceed. I don't have any questions right now. Go ahead and proceed with your report. That'd be great.
Dr. Sosa.
Dr. Sosa, are you still there? I am here. What is your report for Okay, you were talking about the topic there, the question. I didn't want to mention about that you want to report. Thank you. I didn't necessarily have more. I based my initial comments on what I understood the initial questions to be related to. So I was hoping that by starting there, it might make your specific questions more clear and give me an opportunity to respond to in terms of what's happening in the city, unfortunately at this point in time, we are seeing case rates come down. With that, we're seeing similar percent positivity, so you're starting to see counties move to yellow, and that one or two metrics comes down, which is good news. It's capacity protecting and that's gone up, and the numbers of cases and non-community transition has come way back down. So that's particularly good news. As you may know from the press, there are things on the horizon that we worry about with COVID coming back again. Every time we think we've turned a corner, it turns out something else surprises us, and we're constantly on alert for these rates to start going back up again. The major concern right now is that mutations of the virus that lead to a virus that can spread more easily have started to be seen. What happens when a variant virus like this shows up and that it starts to dominate the strains of virus in the community has an advantage in the community that it can spread more readily and it tends to become more dominant and then lead to more and more spread. So these what are called variants of the SARS-CoV-2 virus, variants of concern are a national concern right now. There's been international travel constraints and a lot of urging very cautious COVID safe practices, maintaining the mask and the distance, things that have worked so far to contain spread. Need all the more attention when the virus, if the virus mutates to become more infectious. So that's the big concern on the horizon. Others are gathering. There's concerns, of course, with Super Bowl on Sunday, that folks will, get together in households and one another, and, those will become spreading, events as well. So, while we're pleased with the trend, in infections, we're pleased with our, use of the limited vaccine that we're getting, making some headway in, increasing, protection. Mexico, we still have many concerns ahead.
Thank you, Dr.
Thank you, Dr. Levy. I'm going to go ahead and break the ice on this bill.
I
I heard you talking about changing, metrics, but does that, does change metrics have anything to do with, the governor changing the gating criteria that's out there right now? We got schools that are going to be opening back up, hybrid, back. What are we going to do? What are we going to do there? We're at a point now where I'm not sure that radio or green going to be that big of a difference in spreading. I know the large has been an issue, but are we looking at having the opportunity to change the gating criteria for each area back open state? Yeah, thank you, sir. I know this is a major concern for the governor. A lot of attention to, getting the metrics right, getting the right balance of protection and economic and social activity back in place. What we know from experience so far with the coronavirus is that indoor gatherings are the riskiest ones for transmission. As an example, indoor restaurants continue to be a concern for spread.
You are unmuted.
We're protected enough when
You are muted.
interacting with someone with the virus in an indoor setting goes down and up, and I expect that reopen. Whether the governor chooses to raise the threshold for that, so that it's not between current threshold of 8 cases per 100,000 per day, 5%. It's not something I'm familiar with, but I'm sure she is daily deliberating based on understanding the challenges that you and others in the state are experiencing.
Dr.
Schultz, thank you for that. I didn't have to ask that question. I have relatives that are over in Texas, and I'm just hoping at some point in time we can get where we're looking for like Texas, not things like that. I know they have some of those parts or something. Somewhere out there, trying to get our restaurants back open. And have everybody put right over the Texas to be able to keep their economy up and running. Yes, sir, I understand that, and I'm convinced the governor is, again, looking daily to, consider these factors. And the point you made about health system is really a critical one for Mexico. They're not as flat in Texas with the amount of healthcare resources, and we were really on the verge during the last week of overwhelming our hospitals. So we do know what the max is that if we can handle. We'd rather not see that again, of course, than we would. But that is a major driver of these kinds of decisions. We lose our capacity to care for all the patients who are hospitalization because of this virus, and I think that is just so significant and worsening.
Thank you. Just one last question.
I feel blessed to get my first vaccine yesterday. Can you give us some type of a report on the vaccines for state of Mexico, statewide? Yeah, unfortunately, I'm not the best informed of vaccine distribution policies and plans. I know that we get a weekly amount of vaccines on the state, which is not what we need, not sufficient to do the amount of vaccination that we're prepared to be doing. So we're one of the top states in terms of the percentage of our supply that's been administered already, because we're prepared to give these vaccines. But we've, just like all parts of the country, we've been constrained in terms of the amount of vaccine that's available. We have moved beyond frontline healthcare workers, so the priority group for those that would be at highest risk of severe outcomes from COVID, like residents of long-term care facilities, getting vaccinations, and persons of highest age, 75 and older, persons with underlying conditions who have been shown to have worse outcomes, severe hospitalizations, in the priority for vaccination. And the vaccine is being distributed around the state currently in a pro-rata, so based on the population. So different areas may be moving at different speeds to these priority groups based on the demand in the priority group. But I know the governor is using our capacity to deliver vaccine, and the low percentage of the visual vaccine that we have in the state as a bargaining tool to advocate for more vaccines from the federal government. So I'm hopeful her voice will be heard, and that we can do our best to get as much supply so that we can get it out to people.
Thank you, Dr. Commissioners. Commissioner Bilberry.
Dr. Sullivan, I'm going to ask a question that I get asked pretty regularly. Why the spike differences here in Chaves County, that the numbers go from, for instance, at Christmas, before Christmas, 15 days before, this is a question of that, we had 54 cases a day, and then the day of Christmas or day before went to 293, and then 103 the day after, and then 10 days later it's down to 47. How can you explain those kind of spikes up and down? I get asked that question, I don't have an answer to it. Can you answer that?
Dr. Sosa.
Could you hear that question from Commissioner Bilberry? I'm sorry, Commissioner, I did not hear it. Could you repeat it?
Can you still
Can you hear me now?
I can't hear you.
Star 6?
Okay, can you hear me now, Dr. Sullivan?
Please try.
Okay, how's that? That's better?
That is better. Thank you.
Okay. Dr. Sullivan, I've been asked this question many times, and I'm going to use back in December as an example. In Chaves County, there was 15 days prior to Christmas, it's been 4 cases a day.
Okay. Here you go, Jeff. Just want everyone to see that.
Can you hear me now?
Should come right off the side.
How about now, Dr. Sullivan?
Here, try.
He mute his.
How about now? Okay. This is a question I've been asked several times, and it has to do back in December when the 15 days before Christmas, there was 54 cases per day, And then the day before Christmas, we had 293 cases. The day of Christmas, 103, and then 10 days later, it's down to 47. The spike like that, people feel like that's very kind of coincidental. Do you have an explanation for those kind of spikes? You see, like today, there was, I think we just got 3 cases, active cases made that yesterday. Do we wait for 10 days and we have another 100 cases or something that spikes up and down? Can you explain those?
Thank you for that question, Commissioner. The way that we have been reporting cases since the beginning of the pandemic, in order to get the most current information we have out to the public, is reporting what is reported to us on a daily basis. So as I mentioned, laboratories will submit electronically their laboratory results. A positive laboratory result is considered a case, and we then initiate the process of reviewing that case to further clarify that the test positive, the already identified as a case, not a case, with this information cataloged, etc. The advantage of basing case counts daily on the lab results is that it's quick and it gives us the most information we can get. The lab results getting reported vary from day to day. The testing that's going on varies from day to day. The lab capacity has varied from day to day. So we do have another method of reporting results by the date that the specimen was collected that addresses delays in reporting that sometimes occur, IT issues that might cause a day-to-day fluctuation. But the decision was made to report the results as soon as we get them. So that's why you're seeing all of the noise that gets involved in an electronic transmission of lab results and information systems that are less than perfect, that result in day-to-day variation that is not necessarily reflective of the case onset. When we report the 7-day average, the intention there is to smooth out some of those reporting issues. So we often have that line in the curve that shows the 7-day rolling average, previous 7 days, and then divided by 7. Basically, we'll reduce some of that variation due to the human side of trying to get all these reports together. So it is unfortunate, though, that on a daily basis it can look like major variation, which, as you know, is not what's happening in the When we look at the red to green metric, for example, we use a 14-day period of time to average out those kinds of artifacts, I would call them, of how reporting happens, so that we have a better average understanding of what the case rates are and the overall percent positivity. But on a daily basis, given the way we're reporting it, it does look messy, and I apologize for that.
Well, it's just market, and we want to get our babies to our schools, and everything back open, and it seems like maybe some inconsistencies in these numbers and in the way they're reported. Is there a way to get that tightened up to where that we're not causing such detriment to our communities here?
Yeah, so I would say that the inconsistencies are not inaccuracies. It's just that they're not timed to the actual day in a way that they make sense to you, which is why we don't report or we don't base our opening closing decisions on a single day's result. Rather, we look at multiple days, a week or 2 weeks combined, where that variation in daily reporting gets balanced out. But we're not over-reporting or under-reporting actual cases in this process. It's just that the date of reporting has a lot of variation. But
Dr. Sosa, thank you. Real quick, we have a question from the county manager for Curry County, Lance Pyle.
Thank you. Great.
What happened?
The thing came out.
But our kids are in a hybrid approach. Is there any plans on changing that and looking at how to get the kids back in school full-time with their classes?
Thank you for that question related to school in-person learning. There's a lot of interest clearly in getting back to in-person learning. Recognition that the distance learning has been detrimental to education and a variety of other social needs of our kids and our adults and our parents. The public education department is working to cautiously and carefully expand in-person learning. We anticipate new guidance and encouragement from the Centers for Disease Control and Prevention in the next week or two related to the priority for increasing in-person learning. I would say, just for context, however, while children are less likely to have severe disease and even less likely to have symptomatic disease, we do know that transmission occurs from children who are asymptomatic, and it's absolutely key that we get community rates of disease down so that transmission is not happening in schools. We've learned a lot from the pandemic, that the school environment, the way it's been configured for in-person learning, has done a lot to reduce in-school transmission. That spread within schools from students to staff, staff to student, student to student, really appears to be reduced given the measures that are being taken for in-person learning. So those are very good findings that help support more in-person learning. But we need to at the same time be attentive to these control measures, distancing, mask wearing, hygiene, and testing so that we can pick up disease early. I will say that testing in children is about one quarter of the amount of testing that's happening in adults. So to some degree, we're not seeing as much disease and infection in children because we're not testing as much. So it continues to be important to be testing in children so that we identify infections and reduce transmission associated with it. I'm not a part of the public education department. We provide advice to them regarding some of these measures and how best to safely open. But I do know through those conversations that getting back to in-person learning is a very high priority, and that the guidance and approaches to this are evolving, and we should expect to continue to get new guidance and more support for in-person learning going forward.
And Doctor, am I understanding correctly on that? Within the next week or so, more information will come out, and it could possibly be that from doing a hybrid, it could be 5 days a week or another day a week, increasing that class size. Am I understanding you correctly? That's being looked at.
So the timing of moving from hybrid to full in-person learning is continually being revisited by the public education department. I don't know what their current plans are for in case of transitioning from hybrid to full in-person. I don't think, from what I've seen of the Centers for Disease Control and Prevention guidance, that is specifically going to be addressed in their guidance. Their guidance is more about the importance of vaccination, of testing, of the COVID safe practices, of community rates, and giving some numbers to consider associated with openings and things along those lines. So the more specific thresholds and guidance will be coming from the Public Education Department. And I don't have a timeline on that. And I don't know what we're currently considering as the sequencing pace to move from hybrid to full in-person.
Thank you. Will you just relay that it's of interest to us and we would like that looked at and transition in with the elementary school and see if we can get something going, because the impact this is having is going to be years impact to correct.
Absolutely. I'm happy to share my conversation today with colleagues in the education department. Lance, thank you for that. Dr. Sosa, real quick, question from City Councilman Perry, City of Roswell. Potential preliminary acts, executive orders on our southern border from the new administration in the White House. What is the prayer for a potential influx of population, specifically concerning the virus and vaccinations? So was that question about border influx or Texas to New Mexico? I wasn't. No. This is from Mexico. Okay, this is from Mexico. I'm not specifically aware either of federal changes in the flow of immigrants from the southern border, nor of particular plans in New Mexico regarding that. We're always attentive to the importance of testing and knowing what we're dealing with respect to infectious diseases, communicable diseases on the border, and would expect that if there are increases in border crossings, that we would need to increase our capacity to provide testing resources and appropriate isolation points and resources to address that. I'm an epidemiologist in the position, so some of the larger questions about immigration policy are really beyond my expertise. And I think you're correct. It's not necessarily a medical question, it's a political question. We open our borders up and the caravans that are coming from the southern part of the Central America. That's going to pose a real problem for us as far as our medical facilities also. So that's just something that the governor and the administration in Washington D.C. are going to have to take into consideration, or we can be overflowed in our hospitals and medical capabilities. So thank you for that answer, and I know you can't really jump into the political aspect of it. Commissioner, anybody else?
Got any questions from our president of the Roswell Independent School District? No. Okay. If we have any questions that come across on Facebook?
Mm-mm.
No. Dr. Sosa, can you still hear
I can't hear you.
me? Okay. It doesn't appear that we have any more questions. We really appreciate you being with us today to answer some of these questions. I know that it's a daunting task that we face here, not only in the state of Mexico, but this country. in dealing with this COVID virus mutations. I know, can you speak just real briefly, not briefly, as long as it takes, on these mutations that are coming from the UK, South Africa, that seem to be a major concern to doctors around the country. I know we've been down in Houston, and there's some real concern. So can you speak to those?
Sure. Thank you, Commissioner. These new variants are not a surprise that they occur. Respiratory viruses like influenza and now this SARS-CoV-2 virus have regular mutations in their growth cycles, and every once in a while you will have one that develops a characteristic that makes it more able to propagate and spread and cause severe disease. Most often, the finding is that transmission will occur, spread will occur more readily, and that allows the virus to dominate other viral strains. Killing off a host is not a good strategy for a virus, and it's much less often that you'll get a strain that starts to dominate that is more severe and more transmissible, which would be required to dominate. So what we've seen so far appears to be viral strains that have a better ability to spread. That might be because it takes a smaller amount of virus to cause infection. That may be because it lingers in the air a little better. It's more resistant in some way. Or it may affect our immune system in a slightly different way. So these variants that we've seen from the United Kingdom, from South Africa, from Brazil, currently appear to be more infectious, maybe something between 30% to 50% more likely to spread, but do not appear to be at the present time more severe in terms of illness. Of course, the existing SARS-CoV dominant viral strain is severe enough to overwhelm, potentially overwhelm communities in our healthcare system. So any virus that spreads more and can create the chance of more disease will lead to more hospitalizations and more deaths, and that's what we're worried about. The other thing that raises concern is that in some places like the United Kingdom, where they were in a lockdown at the time that this virus started to take, take hold, the concern is that the standard measures, even if we follow them effectively, will not be as effective as they were for the initial strain, the strains that we're largely seeing right now in New Mexico. So the risk is that we might see another surge, and that's what most hospitals and doctors are worried about across the country, is a more severe strain becomes dominant and leads to increased case counts, increased hospitalizations, and increased deaths. So what's happened since these strains became recognized is that the country and we in New Mexico are doing a lot more testing. Virus is growing them or testing them, sequencing them to identify variation in strains, so that we're quicker to identify a new strain and quicker to be able to see if that strain is starting to become dominant, which would indicate that it has a selection advantage, maybe more transmissible, and needs to be more carefully monitored and responded to. So there's a fair amount of activity across the country to get more specimens sequenced, to look for these strains, so that we're quicker on the ball to know when they're happening and what kinds of trends over time are happening. Again, at the present time, it appears the vaccine is effective, will remain effective for these strains. There might be some variation in the new strain or even these strains over time in terms of effectiveness, and we need to adjust our vaccine in a way that we do with influenza, putting different strains in the vaccine. All of these are challenging because, as you know, getting enough vaccine manufactured fast enough for the whole country was a challenge for one strain. So if new strains become an issue, it will challenge our ability to immunize the population to these new strains. So the importance of bringing down the virus and the transmission, the spread, as quickly as possible right now increases the chances that we could suppress the variant strains as well, which is why the emphasis on vaccination and public safe practices. Are there other specific questions about the variants that you'd like me to respond to?
I think you answered those pretty thoroughly, and I was wondering about how the current vaccines we're going to get after they will get are going to deal with that. But I think you answered that question. I've got a quick question. Go ahead and respond to that.
And then I have the
School board president.
infant school officials that wants to ask a question. Sure. I was just going to say that absence of evidence is not always the best information. So this is the vaccine's effectiveness against variants is a high priority nationally and in New Mexico. And more will be known as we get more vaccines out and we watch transmission and the possibility of people vaccinated who become infected, whether it's with these new strains or not. So more information will be coming on the effectiveness of vaccine, but from our understanding of the current vaccine and what's different about these viruses, we do expect the vaccine to be effective.
Okay, thank you, Doctor.
Thank you, Doctor.
You have the school board president of the Roswell Independent School District, Ms. Hope Morales, and wants to ask a question.
Good morning, Dr. Sosin.
My question is, as the state doing different safety orders, are all of them being tested out? And one that I'm most concerned with recently is related to the requirement of our football players wearing face masks while they have their mouthpieces and helmets on. Are we sure that this is safe for their breathing? And also it being contact sport, if those face masks happen to move and shield their eyes, it can cause serious injury in the contact sport.
Yeah, thank you for that question. I have to admit, I'm not familiar with the requirement for face masks in football. Youth sports are being handled in very different ways in different parts of in different communities in terms of which sports are restarting and how they're being approached. We routinely get questions about youth sports, and we provide general information about the practices that are most likely to limit spread, including sports that are outdoors or safer than sports that are indoors, sports that are non-contact and safer than sports that are contact. There clearly are some sports where a mask is not appropriate. We've had discussion about wrestling. That is the ultimate contact sport for transmission. That would be one of the highest risk youth sports activities. And a mask would not be appropriate in that setting. I do believe that, at the level of the youth sports activity, that some decisions need to be made about what protections are causing a risk or not a risk. And that experience of attempting to wear face masks in football and whether the mask is becoming problematic to maintain would require then revisiting the approaches to continuing safe football activities. So with sports like football, the non-contact drills and activities where spacing, where potentially mask wearing can be done without risk, are again better than those that are full-on game scenarios where that plays out. I have to say I've not been approached with the question of should, if we're going to proceed with football contact, is a mask better or worse in terms of safety of the kids? Is not a question that I've been posed. I would need to better understand what you described as, how does the face mask itself protect the helmet, protect the face mask from being dislodged, and what kinds of issues have been experienced with that before I can answer a question about whether it might be causing more harm than good. So I apologize if that's not a clean answer to a very complex question, but it does seem to warrant more discussion. Perhaps you could also clarify for me, and I'd be happy to go back and get more input to this question, but how are youth sports activities in your school district being established? Was that PED guidance, or was that the school district itself setting guidance for the Youth Sports Association?
As far as I understand, it's the governor's order that school districts that choose to go into hybrid can't participate in sports according with the guidelines of the NNA and the governor's office. Beginning on February 22nd, she stated that schools need to be in a hybrid model for at least 2 weeks to track the data, and then sports would be allowed when we started with fall sports, and football is one of those sports. So again, my concern is just that this safety order is coming down from the state. I just want to feel comfortable that it has been tested and our student athletes are going to be safe.
Yeah, so I have seen the NMA guidance. I did not recognize a mask wearing mandate for football, nor familiarity with the start of football in the upcoming weeks. So let me go back and look at that guidance, and we can revisit that question. My concern is that the alternative in a contact sport like that would be not to hold the contact sport, which is the safer, the health-wise safer option, but not the necessarily option that the community would prefer on that. So it's a great question. I'm obviously fumbling a bit to answer it because it's complicated, and I'll need to follow up and get some more review of that specific question, football, and what the requirements in NMA are around football restarting.
Thank you. So Dr. Sosa, my last comment, please, if you could look into, instead of saying this sport couldn't happen, to look into the possibility of the glass face shield or the plastic face shield over the helmets be an option in place of the face masks or canceling the sport altogether. Thank you, sir.
Thank you, sir.
Thank you. The issue about face masks versus cloth face shields versus cloth face masks or medical face masks is that the shield protects the wearer from the respiratory droplets of an infected person, but it doesn't really keep the respiratory droplets of an infected person and spreading to others. So it's a lesser protection, clearly, than a mask. And ultimately, the decisions, the risk threshold for transmission. The testing capacity to watch for it early are factors that weigh into a decision to make that kind of a change. But, these are all probability-based decisions, and then ultimately decisions of risk tolerance. And appreciate the question and the recommendation, and I will commit to getting some follow-up on this question. I believe I have a contact for the commission, and would relay my response to that.
Thank you for that, Dr. Sosa. Quick question, I'm going to hand this over to Commissioner Zell to ask a question. We have one of our fellow commissioners from Curry County that is wondering if these vaccinations are going to become mandatory, or if they're going to be similar to the flu vaccines that we get in. I think there's some real concern out there that everybody's going to be forced into getting this COVID vaccine. Do you have any thought on that?
I've never seen a medical treatment being required other than for a communicable disease in an infected person, such as tuberculosis. So it seems to me highly unlikely. I've heard no discussion about mandates and requirements for vaccination. What seems more likely is that those who have been vaccinated may have different privileges than those who have not been vaccinated. That seems to be a possibility, although it's challenging to implement those sorts of vaccine certificates and the like as well. So I'm not aware of any current decisions to implement anything of that nature, and it seems unlikely to me that vaccine requirements would be implemented in the United States.
Good. I've got a quick question for Commissioner Zell.
Can you hear me, Dr. Sosa? Why is the red to green program implemented on a county-wide basis? And is there any possibility of it being implemented on a more local basis?
That's a great question. I don't know about the possibility of implementing more locally. I know the governor considered multiple levels of attempting to customize opening practices. I do know from a data standpoint that it's very hard to draw lines and to have accurate data necessarily at community levels. That would be consistent and accurate, but it's a larger question about the customizability of COVID orders that the governor's office would need to answer. Other than knowing that they have considered various levels in the past, I'm not aware of how they're currently viewing that possibility that you raised.
Okay, thank you for that answer.
Commissioner Bilberry has another question for you, Dr. Sosa.
Dr. Sosa had a question sent to me, said if we keep having variants, how can we keep our businesses and our schools locked down year after year? The economic and mental health impact of that.
Yeah, this virus has never acted exactly as we have anticipated from historical experience. So a question like that becomes almost impossible to answer at the moment. As a medical epidemiologist, it seems unlikely to me that we will continue to have variants that essentially become new pandemics on top of new pandemics. We've not seen anything like that in our history. That doesn't mean it could not happen, but it seems more likely, given what we know currently, that the vaccine that we currently have will have a significant impact, that the social changes in this country will have significant impact, like mask wearing, even though it's not complete, it's certainly different than any other, respiratory virus season we've experienced in this country. Our attentiveness to social distancing and other kinds of factors all contribute to, for example, we haven't seen influenza in the state or the country this year. The Southern Hemisphere hasn't seen influenza either. So another similar highly transmissible respiratory virus basically squashed that annually causes 50,000 deaths a year. So I would expect that the current activities that we're doing will achieve the anticipated objectives of late summer, the virus essentially disappearing. It may mean that we need annual vaccination like we do for influenza, and should have the capacity to produce the vaccine much differently than creating a new one, producing it and distributing it. So there's a number of factors that could influence how we control this going forward, but and I can't for sure say that we're not going to have a new pandemic that follows on the heels of getting control of the current virus. But it does seem inconsistent with what we've experienced in the past, and less likely to occur going forward.
Thank you, Dr. So I have one other question text to me. It concerns the public schools being told that the New Mexico protocols 3-minute direct contact with a positive person within the school setting to trigger quarantine. Says, however, the CDC guidelines are 15 minutes of direct contact before that is triggered, and this is with masking.
So the guidance on what a close contact is has evolved over time, and the guidance from CDC started as 2 minutes, moved to a few minutes, and moved to 10 minutes, and then moved to 15 minutes. Not specifically based on any studies that established on those times, but more based on the overall impact and their assessment of the transmission dynamics. In New Mexico, we have been very aggressive to try and limit transmission, recognizing that our healthcare resources are somewhat limited, and we have large numbers of vulnerable, high-risk persons in the state. And the decision was to hold to the earlier 3 minutes that we had established at the time, and that was the CDC guidance. So the impact of this isn't as large as it might seem. If you're going to spend 3 minutes within 6 feet of somebody, that's not casual passing in the hallway. That's not, casual passing in a store or on the street. That's a conversation, albeit a short one, but it's not that different than a 15-minute conversation that you might have in a similar way. So our standard is stricter, which means we might quarantine people more often, which means we might reduce spread slightly better than the wider 15-minute guideline. So that's an explanation of how we got to where we're at right now. And there's been no interest in the leadership to change to the CDC 15 minutes. Over.
Thank you, Dr. Schultz. A question for circle back just a little bit from Commissioner Martin in Curry County as far as mandatory vaccine. If vaccines aren't mandatory, if you're not vaccinated, are your privileges, civil rights going to be restricted? As the commissioner asked, you're going to be kept from flying, you're going to be kept from going into restaurants or going to a place if you haven't been vaccinated. Is that going to be, you think you see that in the future?
I have seen this discussed. in literature and newspapers, etc. We have not had any discussions at my level regarding how that, whether that and how that might be implemented in New Mexico. It's not necessarily all that distinct from school vaccination policies. When there is an outbreak of measles, or mumps, or rubella, that students who are not vaccinated are, kept out of school, need to remotely do remote learning until the outbreak is controlled. There's some precedent for that happening, but I'm not aware of current discussions about it. I think really the focus right now is getting as much virus as much vaccine as we possibly can to everybody who's prepared to take it.
Thank you, Doctor. I think we have possibly exhausted the questions. I just want to let you know that here in the room, we do have a couple of our city councilors from the city of Roswell. We have Ms. Margaret Kennard and Jason Perry, that are city councilors from the city of Roswell. And we spoke with Ms. Hope Morales, who's the president of the school board, and we also have Sean Powell, who is the president of the Roswell Eastern New Mexico University campus. I will say that they've been doing a great job out there, continuing with their vocational programs out on campus, and done a good job with that. General Rizzo had something else come up where he couldn't be here, and I know the Mexican military students done an amazing job of running through this COVID process with the COVID going on. Of course, we have our county clerk and our sheriff and under sheriff, all of us here, but we greatly appreciate your time, and hopefully if we come back around and we have more questions, we'll be able to get you to step up to the plate again and be there to answer these questions for us.
A pleasure to join you all. I appreciate the opportunity, and definitely appreciate the incredible work that you're doing at the county level to address these very challenging requirements and recommendations to contain and control the spread of the SARS-coronavirus. So thank you for your hard efforts. Appreciate the multiple impacts that go beyond the health of residents and have a significant impact on their lives. So appreciate your interest in doing it right, getting it right, and getting your questions answered. I'm happy to come back or by email answer questions that you might pose back to me. So thank you very much.
Thank you again. Thank you for all the attendees there online also. With that, we will close out the session. Thank you again, Dr. Sussman.
They can just close it.
Dear Commissioner, before we jump to the resolution we have on our agenda for today, are there any discussions about this